There are multiple variables involved in deciding which adjuvant chemotherapy to give and how long to give it. Many of the trials that are now ongoing are addressing those two issues. In the past, adjuvant therapy was usually much longer and in some sense much less intense than it is now. Many of the advances in breast cancer adjuvant chemotherapy have revolved around making the chemotherapy more intense or higher dose, but also for a shorter interval. And it's been found by multiple trials that a shorter, more intense type of chemotherapy is more effective. In the hormone setting, which are pills, either the aromatase inhibitors or tamoxifen, the general consensus at this point, after multiple clinical trials, is that 5 years of tamoxifen appears to bring the maximum benefit, and giving tamoxifen for more than 5 years is either marginally beneficial or not additionally beneficial. The bigger dilemma is the aromatase inhibitors that are, in a sense, newer on the scene in the adjuvant setting. And in going with the tamoxifen data, the original trials were all 5 years. There was a recent trial called the MA17 trial that looked at an additional 5 years of an aromatase inhibitor after tamoxifen that showed that that was a positive trial. And there is a current ongoing trial that looks at 5 years of additional aromatase inhibitor after the first 5 years have been completed. That trial has recently completed accrual and will take another 3 or 4 or 5 years for data to become available. At this point, my general advice to patients who have completed 5 years of an aromatase inhibitor is usually to stop. However, if they had a particularly ominous breast cancer in the beginning, characterized usually by multiple positive nodes, I think there's some data that we can extrapolate and say that for those particular patients, an additional 5 years of an aromatase inhibitor may be reasonable, especially if they're tolerating it well.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.